Thank you.
Good afternoon. Thank you very much. I think the topic is going to be a slight break from pain and pain and pain. So it's kind of less painful to talk about something which is probably relevant to all of us more than the patients. Fitness after 40. Well, everybody wants to be fit. Everybody is going to be 40 at some point, or we already are. So what happens then? Various different types of fitness, really. The physical part of fitness, which is commonly associated with the term fitness. But of course, there is psychological fitness, there is sexual fitness, there is spiritual fitness, there is social fitness, and all sorts of fitnesses. We are not going to talk about anything but the physical fitness after the age of 40. Now, as you hit 40, what happens? The metabolism does change a little bit from a balanced metabolism of the youth. It then starts going more towards catabolic state. So by the time when you're a baby and when you're growing up, it's more of anabolism till the age of, say, 18. And then after that, there is a balance between anabolism and catabolism. And what happens at around 40? Well, it's not really just 40. In some people, it does start a little earlier. And I've also come across a lot of people in whom it has started well beyond 50. So it is the balance which changes at the age of 40. So that 40 becomes then a magic figure and things change. And then all of us get aware that, my God, I'm already 40. I need to be fit. What do? Do I start exercise? Now, till that time, you're in your medical school, establishing your practice, running around and doing all sorts of things. So you have no time virtually to look at the fitness part. Some of them do, but most of us don't. And then we start looking at, what can I do to keep myself fit? There are various different definitions of physical fitness. Let's not get into the definition because it does not matter which definition you use. The fitness is a state of your body where there is adequate balance between normal activity and pain. And that is probably how it is related to the pain. When you talk to patients and ask them, look, do you exercise? Oh, I do a lot of walking. My job involves going from one place to the other. I climb 10 flights of stairs in a day. I do 5,000 steps on the site and so on. There's got to be a difference between exertion and exercise. And that is where a lot of people go wrong. Exercise, by definition, is a repetitive activity of muscles, either aerobic or anaerobic, sustained for a period of time, good enough to increase your heart rate, maintain it at a certain level, and then reduce it as you stop it. Whereas in exertion, even though you're probably spending the same number of calories, you're raising your heart rate, there is a start and stop, and therefore you're stopping in between, and therefore there is not a sustained rise in your heart rate, in your blood pressure, in all the metabolic parameters. So one has to differentiate between what is exercise and what is exertion. And you've got to tell the patients as to what you mean by exercise and not just exertion. When it comes to spending calories, yes, exertion is also good enough because that is also equally going to spend the calories. But exercise is going to give you much more benefits rather than the exertion part. Now, different types of exercise, again, there are static exercises, there are dynamic exercises that people would call aerobic exercises, anaerobic exercises. What exercises should one do? How much should one do? When should you do it? And how do you decide when to start, how to start, and so on. Now, the aerobic type, which is the commonest type of exercise many people do, walking, jogging, cycling, swimming, Pilates, Zumba, the latest crazes, and so on. All of them have something in common. You start at rest, and then you build up your heart rate, your blood pressure over a period of time, and you try and sustain it for X amount of minutes. You always start off at a very slow pace and then build up the pace. You always do few minutes first, and as you develop your stamina, your ability to exercise and so on, and then you sustain it. So how much should you do it? Long time ago, American Cardiology Association came up with some guidelines, and then the guidelines said, well, 40 minutes of aerobic activity at least thrice in a week is what is recommended for people beyond the age of 40. What is that true for? 40 minutes of activity. So people suddenly started jogging for 40 minutes, and they went into all sorts of problems, and they had injuries, they had myocardial infarctions, they had all sorts of things. You got to always start with, say, 5 minutes or 10 minutes, depending on your body type, depending on whether you have done the exercise in the past or not. And then as you build up, as you go over weeks and months, you then get to that number of 40. Now, why 3 times a week? There have been many revisions of these guidelines and whatever. And the physiological guideline has got to be, it's got to be every single day. You eat every single day, you sleep every single day, you got to also exercise every single day. Yes, you can afford to be lazy on one of those days and kind of say, okay, I'm not exercising today, but that can't be physiological. If you sleep for, say, 10 hours on any given day, well, that can't be a recommendation that, yes, every Sunday you should sleep for 10 hours. You can choose to do that, but that can't be the recommendation. So the recommendation has got to be 40 minutes every single day. You got to exercise. Now, do you have to do the same exercise over and over again? It can be pretty boring. No, you don't. You can mix and match. You can mix and match not just the aerobic activities, but you can also mix and match aerobic with gym activities or yoga or something else. So, and in fact, when you mix and match these activities, there is a better chance that you're going to utilize all your muscles, you're going to mobilize all the fat wherever it is, and therefore the end result in terms of stamina, the end result in terms of your lung capacities, the end result in terms of muscle strength, and of course the stamina is going to be pretty good. So one can do a mix and match of all these different types of aerobic activities along with anaerobic or gym type of activity. Now, what is the goal? Why, when are you exercising? How do you know that you have exercised enough? What is the goal of exercise? The goal of exercise has got to be, there's something called as target heart rate. Everybody probably would know about it. 220 minus the age, it is the approximate target heart rate for each person. And then you got to reach at least 80 to 85% of that target heart rate to be able to say, yes, I have pushed my heart enough, I have pushed my physiology enough, I've burnt enough calories, and then sustain that increase in the heart rate for at least a period of 20 minutes. So that's where the target heart rate concept comes from. And then what is the stamina? Stamina is essentially the time taken from your baseline heart rate to reach that target heart rate. And obviously, when you see these athletes, allegedly Bjorn Borg, who had a baseline heart rate of 36, took hell of a long time, obviously, from 36 going to his target heart rate of, say, 175 when he won the Wimbledon. So it took a longer time for him, whereas somebody who's pretty unfit and has not exercised before with a baseline heart rate of 100, going from that 100 to 150 is going to be a piece of cake. So it's going to be within 2 minutes and 3 minutes, he's going to reach that target heart rate. So stamina for the first example is pretty good. For the second example, not so very good. So the idea is to build that stamina, and that stamina can be achieved, this can be achieved over a period of time when you're repeating that exercise. Your baseline heart rate does come down, and these are some parameters nowadays with all those fancy watches everybody is wearing. They will give you an idea about your heart rate. They will give you an idea about how fast they go up and they go down. Only this morning I saw one which also told you whether you slept all right last night. Any idea how they do it? Well, I don't. The other goal of exercise has got to be to build strength into the muscles, and therefore individual muscles or group of muscles exercised in a orderly fashion can build that strength over a period of time. The commonest mistake that is made is somebody gets very motivated, hits the gym, goes and tries some fancy machine with lots of weights, does those weights with completely wrong technique and ends up having an injury and stopping that exercise for good, or worse still, for the rest of his life. That's not what is intended. When you're exercising, you got to do it with the correct technique. Initially, there's no harm asking somebody to give you that guidance as to what the correct technique is and so on. Now, when you're running or cycling or jogging or doing the gym or whatever, pain is an essential component of it. It is going to come. Pain not necessarily because of bad technique, but untrained muscles, when they are worked for the very first time or first few times, they are going to hurt. Now, you got to judge whether this pain is only because of use of those muscles or abuse of those muscles. And if it is abuse of those muscles, then obviously some of my colleagues who talk wonderful presentations, before me, they should be able to guide you as to whether that is abuse of those muscles and how to correct it with the various different techniques. Now, the duration of exercise, it increases over a period of time. When you start doing exercise after 40, initially you could be doing 5 minutes, 10 minutes, or 15 minutes, or so on. And then over a period of time, as you build that stamina, it goes on. And then I have come across people who do 2 hours and 3 hours in a day, and yet they don't feel as if they have done adequate exercise. Now, yes, there is a chance that people can get addicted to it. I'm using the word addiction in the wrong way, but that is what a lot of people are. There was a very good point raised a couple of talks ago about these weekend activities. A lot of people after 40, a lot of doctors we see these days who run marathons. Now, these people had never done any exercise for the first 35 or maybe even 45 years of their life. And now all of a sudden they get motivated. Oh, everybody's running, I must run as well. So you see, half the runners in these weekend activities are actually doctors who are running these half marathons and full marathons. Well, when you're running a race, the race is not to get fitness. It is for fit people. So, and same thing true for the weekend gamers as well. You ask somebody, what do you do for your exercise? Oh, I have recently started playing badminton. No, it's not an exercise which will give you fitness. It is actually, you got to get fitness first and then go and play the game. If not, you're very likely going to get injured, and then your game is going to be over in no time. So the duration is going to increase. What about timing? What time of the day should you be exercising? Any time, really. There is no reason why somebody cannot exercise from 10 o'clock at night to 11 o'clock at night. It's not very great for them when they go back to sleep later on, but for the exercise bit, or to burn those calories and to gain that physiological advantage, it is not a must that exercise has to be done at a particular time. So when somebody asks you, when can I exercise? You just have to ask them, when do you have time? And whenever you have time, you can exercise. That shouldn't matter as to when you exercise. What are the benefits? Why are we exercising? Why are we doing all that? Multiple benefits. Of course, there is a proof. There is reduced cardiovascular mortality and morbidity with regular exercise. Therefore, we are exercising. Exercise also becomes important for weight management, and therefore you want to exercise. Treatment of other illnesses such as hypertension, such as diabetes. Of course, they are better managed when you're exercising. Decent proof that systolic pressure goes down by 6 and diastolic by about 4 when you're regularly exercising. So your drug requirement may be less in those. There's a social benefit as well. When you're doing that, it's likely to be a group activity, and you're going to meet people, and you're going to have a good time of the day. And of course, exercise will give you that sense of well-being. And therefore, yes, it is excellent to exercise. I'll just take one more minute. So, why is exercise and fitness more important after 40? Well, it's kind of like buying a new car. You know, when you buy a new car, you don't need to service it for the first 1 or 2 years. It doesn't matter whether you service it or not. It's going to work perfectly well. But it's only when it's going to get old, you're going to have to maintain it, and you're going to keep it running so that it runs for a long period of time. So it's kind of like that you've got to exercise. And so it's more important to exercise when you're 40 than probably when you're 15 or 16. We are not taught the same way. We are told, oh, it's so important to exercise earlier on in life, and later on you can relax. Well, it never happens like that. The time, place, type of exercise is unimportant, really. When you're newly starting exercise after 40, a word of caution, really, that if you are going to take on aerobic activity in a big way, some basic things like an ECG, maybe even a stress test, an echocardiogram to make sure you don't have hypertrophic cardiomyopathy or something like that. You got to do those before you start exercise after 40. And of course, combination of various different types of exercise is important. It can be done, and it is beneficial to you. Thank you.
Thank you, Dr. Biniwale. The house is open for questions, if any is there. Fantastic lecture. Eye-opener. Thank you so much. So we close this session. We welcome you all for joining us for lunch. We meet again at 2 o'clock. Thank you.